Greetings and welcome to NED Talks. I'm Catherine Ford, the Program Director for Educational Development. NED Talks are an opportunity to highlight and profile a Minnesota State faculty or staff member who has a passion for pedagogy and practice. It's my hope that we can share the good work that's being done around Minnesota State and get to know each other a little bit better in the process. I'd like to introduce you to Jen Timm, who's Associate Professor in the Department of Graduate Nursing at Winona State University. I first met Jen this past fall on the System-Wide Faculty Development Committee. So welcome, Jen. Thank you so much for joining me today. And I have a few questions I'm going to ask you, and I'm really looking forward to hearing what you will share. So the first question is, did you know? What is something that someone might not know about you?
Thanks, Catherine. Well, something you might not know about me is I am born and raised a rural girl. So I was born and raised in a very small town in the middle of Iowa on a hobby farm. And we had everything under the sun that you could imagine on a hobby farm: kittens and dogs and calves and chickens and goats and horses and ponies and all of that. And after graduating from high school, I moved straight to rural Winona, Minnesota, and I've congregated in this area since. And I currently now live in a small town just west of La Crosse, Wisconsin, La Crescent, Minnesota, which sits right on the Mississippi River and is one of the most rural counties on the eastern side of Minnesota.
What is something that you're involved in, either at your institution or at the system level, that you'd like to feature relating to teaching and learning?
So I am part of this amazing interprofessional team at Winona State University who coordinate and run the Bridges Health Program. And the Bridges Health Program is an interprofessional clinical education model that we designed for our local area here in the Winona and surrounding area to not only meet the needs of our students and their learning needs in the areas of interprofessional practice and care for underserved and rural populations, but also to meet academic program needs and increasing demands on clinical and practicum and field placement sites. So our model is a very reciprocal model through academic community partnership that brings students together from a variety of different academic programs, health and non-health students, and provides them a setting to learn with one another, and all through the time while delivering accessible preventive health and wellness services to underserved groups in the rural area that we live, work, and play here. So that program is growing and expanding at Winona State University and has pioneered a pathway for interprofessional practice in our academic institution. And it's been a great journey to be part of. It provides a really authentic and different opportunity for students to learn and thrive in developing the skills so necessary for them to have when entering today's complex work environment out there. I mean, healthcare today, clearly we're living in the middle of a pandemic, is complex and it's changing and it's multifaceted. Our future health professionals need to be trained in a high degree of teamwork and collaboration and working across professions to be able to effectively respond to these increasing needs and to improve patient outcomes at the population level.
My last question is, what excites you about teaching and learning? Kind of what catches you on fire or gives you energy for that jazz hand moment?
Certainly just thinking about the possibilities, especially during this time. We're living in a very interesting and pivotal time for us as educators to be open and amenable and nimble in our teaching and learning strategies. And not only is there an opportunity for that, there's a responsibility in that as well, because we need to be preparing our students for the reality and for the current and forthcoming work environment that they're stepping into, which is different than it was a year ago. So that's what gives me the jazz hands. is thinking about all the opportunity that we're faced with right now. And I'm really excited about the future.
Thank you so much for spending some time with me today and your willingness to share your time and a little bit about yourself and your passion. It's really been a joy. It's been pretty fabulous. So thank you. And I look forward to future conversations.
Thanks, Catherine. Thanks so much.